Good afternoon. Thank you so much for joining the Primary Care Innovations webinar series, which is supported by the H. James Free Center for Primary Care Education and Innovation here at the University of Florida. Before we get started on today's presentation, wanted to cover a few housekeeping items. Please mute your audio and turn off your video during the presentation, as we'll be recording this for future viewing. If you decide to keep your video on, just know you'll be forever a part of this webcast. You can link to past webinars at primarycareinnovations.cme.ufl.edu and encourage you to check out some of the content we have there from prior presentations. Please type questions using the chat function. And at the end of this presentation, I'll lead a Q&A with the presenters. To claim 1 hour of CME credit for this session, please complete the evaluation, which will be sent to you at the end of the webinar. And finally, next month, please join us on November 6th for a presentation by Drs. Andrea Koff and Carl Smith titled Thinking Inside the Pillbox, Integration of Pharmacists into a Geriatric Primary Care Team, Decreasing Hospitalizations. Today, we're thrilled to have Vincent Roth, Jabbar Dundar, and Kelsey Williamson from the University of Florida College of Medicine. Vincent is a fourth-year medical student at the University of Florida. He was an LGBTQ Night co-director at Equal Access from November 17th to, November 2017 to November 2018. Completed his bachelor's in biomedical sciences at the University of South Florida and is preparing to apply for residency training in anesthesiology. Jabbar is a third-year student at the University of Florida College of Medicine. He was an LGBTQ Night co-director at Equal Access Clinic from November 2018 to December 2019 and completed a Bachelor of Science degree and major in microbiology and cell science at UF and is planning to pursue a career in pediatrics. Finally, Kelsey's a third-year student at UF College of Medicine. She attended the University of Florida for undergrad and she majored in biochem and psychology. She has served as a co-director at Equal Access LGBTQ Night and plans to go into child and adolescent psychiatry in the future. And while I'm not formally presenting today, I also serve as an attending physician and faculty mentor for this clinic. So we'll answer some questions potentially at the end if they come up. Thank you all for presenting today, and I'm going to turn the presentation over to Vincent.
All right. Thank you so much for introducing us all, Dr. Null. And today we're going to be talking about a student-led model for providing LGBTQ+ directed healthcare in a student-run free clinic. So the goals of our presentation today are to describe a student-led model for delivering LGBTQ+ affirmative healthcare, to describe a protocol-driven approach to providing gender-affirming therapy, and to outline steps in the development of a PrEP or pre-exposure prophylaxis clinic for vulnerable populations in a student-run free clinic. All right, so there are many things that contribute to disparities in LGBTQ+ healthcare. Some things that contribute are homelessness, poverty, other kinds of structural discrimination on top of anti-LGBTQ+ discrimination, and then lack of cultural competence in society and on the part of healthcare providers. All right, so some examples of LGBTQ+ healthcare disparities are LGBTQ+ individuals are more than twice as likely as straight individuals to have a mental health disorder. Suicide attempts are about 3 times as more common among bisexual individuals compared to straight individuals. Sexual minorities have a greater risk of substance use disorders, and compared to non-sexual minority youth, sexual minority youth are twice as likely to report being bullied. Some other disparities in healthcare include that LGBTQ+ people are 2 times more likely to smoke. When we consider LGBT, lesbian and bisexual women, they are 10 times less likely than heterosexual women to get cancer screenings. And when it comes to gay and bisexual men, they are 79 times more likely to be diagnosed with HIV compared to the heterosexual males. All right. So a large proportion of LGBTQ patients are not out to their doctor. Some reasons listed by patients in a study done by the Mazzoni Center include embarrassment, fear of refusal to treat, or breach of confidentiality by their doctor. And then, as you can see from the Rainbow Health Initiative, 1 in 4 LGBTQ respondents reported receiving poor quality care from their doctor based on their orientation. All right, here is an image from the National Transgender Discrimination Survey. As you can see, blue is states in America that have banned insurance exclusions for transgender individuals. There are a few states, light blue states are states that have inclusive health benefits for state employees, and then dark blue states have both. As you can see, unfortunately, Florida has neither of those. And as a country as a whole, we still have a long way to go. All right. So a former UFCOM student, Erica Wirt, who graduated in the class of 2020, conducted a survey here in North Central Florida, asking participants in the LGBTQ plus community about their experiences with healthcare and any discrimination they've faced. So I thought it was important to just read some of those quotes to you all. First of all, the doctor basically told me he thought I was trans because I must have been molested and kidnapped as a child. That wasn't a subtle thing. He said that. Another patient reported, I'm sure you've heard of the term minority stress. A lot of those comorbidities like anxiety and agoraphobia and on and off bouts of depression and low self-esteem, lack of safety in society to express yourself, they lead to all sorts of issues. It makes it scary to be myself. Another transgender woman reports, most of the time they don't realize how hurtful and damaging it is, especially when it's repetitive from multiple people throughout the day. Even if it's just a slip, it's partially that they're not assuming any cognitive burden to make the correction. And lastly, I've found providers who are accepting, but there's a gap in knowledge. It's more of a situation where I'm educating a provider instead of a provider educating me. I shouldn't have to do that. I go to get answers and then I have to do all of the research on my own.
All right. So Equal Access Clinic is our free student-run clinic that was created in 1992 to provide care for underserved patients in Alachua County, Florida. Over the years, we've become one of the largest student-run clinics in the country, serving over 2,500 patients last year alone. Our efforts are very much collaborative, relying on volunteers from the undergraduate level to healthcare professional graduate students and UF faculty. It's primarily coordinated by medical students. Our clinic operates Monday to Thursday at 4 different sites around Gainesville, offering primary care services, as well as specialty services, including ophthalmology, mental health, women's care, and LGBTQ plus care. So our LGBTQ plus night actually began back in March of 2016 after 2 first-year medical students realized that we really had no dedicated opportunities for training students to care for LGBTQ plus patients. So after some faculty recruitment and discussions with EAC leadership, it was decided that LGBTQ plus night would be the 3rd Tuesday of every month at our Eastside Clinic location. Since then, our clinic has been able to expand our available services to include gender-affirming therapy back in March of 2018, pre-exposure prophylaxis for HIV, also known as PrEP, by September 2019, and on-site mental health and social services by October of 2019. So on this slide, we've outlined the mission statement for our LGBTQ plus night, but I went ahead and bolded the highlights. So our goal is basically to provide informed and culturally relevant healthcare to underserved Alachua County residents who identify as a sexual or gender minority in a safe and confidential space. We also work to get them plugged into local health resources and follow up with them to enhance their success in staying connected. Of note, however, we do not restrict access to LGBTQ plus patients on LGBTQ plus night. Anyone's welcome. We just make it a safe space that caters to LGBTQ plus patients specifically. So in order to achieve this mission, we elect 2 LGBTQ plus night medical student officers rather, each year to coordinate the clinic. Those officers are responsible for recruiting LGBTQ plus proficient providers from the University of Florida and for hosting trainings for student volunteers. The volunteer training happens once per semester, and it covers much of the healthcare disparity information that Kelsey already covered earlier. We also spend quite a bit of time working on the use of neutral language in patient encounters, as well as the basics of gender affirming therapy and PrEP. If students are not able to attend this meeting, we meet with students individually before they volunteer to run through the training with them. On LGBTQ+ night, we also give our clinic a makeover to be more inclusive. For instance, we replace the bathroom signs with gender neutral signs, we hang pride flags, and put up an informational poster board full of resources for patients to check out. As far as marketing, we channel a lot of our efforts into our online presence by posting reminders about our clinic night on a number of Facebook groups. We also hang our flyers, which we have a picture of on the right side of the screen, throughout the hospital and the community. Whenever the opportunity arises, we also table local pride events and any other LGBTQ health events that we hear about. One final and important part of our model is tracking our impact. So we used to collect paper forms on intake with information about what patients were seeking and how they heard about us. But now we actually have a new completely electronic method called Clinic Navigator that we'll walk you through a little bit later that tracks all this information and automatically organizes it and records it. And so here we just have some pictures of us at local events.
So a big part of who we are is based on interprofessionalism. And it's really what we think makes Equal Access Clinic and LGBTQ Night a success. Every volunteer, from the undergrads and health professional students to the social workers and attendings, they each play a crucial role and come together to provide the best care possible for our patients. For example, the pharmacy students, they're a big part of deciding on medications, but not only are they actively working to make sure the right medications is prescribed with the right dosing, but they also use online tools such as GoodRx to find the most affordable options for our patients. The pharmacy students even work with our patients to help complete company or government assistance programs so that they can be eligible for free or discounted medications. This is especially important for our pre-exposure prophylaxis program, which we'll be talking about in a few minutes. The undergraduate students play a really important role in our clinic. They're the first ones to greet the patients and are involved in everything from ensuring clinic flow, making and following up on appointments, completing intake forms. They collect the basic patient information such as demographics and follow-up info. They screen patients for mental health with tools such as the GAD-7 and even for intimate partner violence so that we can provide our patients with the right resources. And even some of the undergraduate students in our clinic are even certified to do HIV testing by the health department, which is a huge help for us. The latest addition to our volunteers are counseling psychologists and social workers, like Vincent mentioned. And given what Kelsey discussed at the beginning of the presentation with regards to some of the health disparities that the LGBTQ community faces, we think that the mental health is an especially important aspect of healthcare that has to be addressed in our clinic. If our patients screen positive for the psychosocial distress at any point, our counseling psychology colleagues do about 30 minutes of intervention, and the patients are given the opportunity to follow up during one of the EAC's mental health nights as needed. So on the next slide, we have a diagram of our precepting room at our clinic. So just to give a better perspective on how our clinic is run, I'll walk us through a scenario of a typical patient encounter. So a patient would walk into the waiting room, would be asked to complete an intake form by one of the undergrad volunteers. Like I mentioned, these volunteers work directly with the patients and take their vitals, do an initial assessment, and then take them to an available room. They then would present the patient to one of our medical or physician assistant students who would go and meet the patient in the room, complete a history and physical, come up with an assessment and plan, and present to the attending. After the presentation, both the student and the attending go back, see the patient, evaluate them one last time, and finalize the plan of care. They will also consult social work or counseling psychology based on patient's needs, and finally the patient's discharge. So as a clinic, we've developed tools to ensure that this large team of volunteers made up of all these different professions that we brought together can actually provide care in a way that is both efficient and productive. On the next slide, something that we really rely on every clinic night is our clinic tracker. We're really proud of it. It really helps us organize our clinic flow, makes sure that everyone is on the same page, regardless if it is their first night volunteering at the clinic or the 100th. The tracker is visible to every volunteer at all times. We project it on a big screen in the precepting room, and it's accessible on volunteers' personal devices as well, like their laptops or their phones. So the patients are checked in by the undergrad volunteers, assigned a number and a chief complaint. As you can see on the right-hand side, You can see the columns with the patient numbers. So, and each have a link to the patient's chart on Practice Fusion, which is the electronic health record program that we use. The next column is a link to the clinic navigator for that patient, which is another great tool that we'll be talking about in a few minutes. In the rest of the columns to the right, we can track how many patients are being seen, the status of the patients, the time that they have been waiting at each stage of the process, where they're located in the clinic, which medical or PA students will be seeing them, and the attending assigned to them. At the top of the tracker, we can see the general information about the clinic, for example, who the officers are, the attendings are for the night, how many patients are waiting for intake or still have to see the attending. So the next slide is another view of the clinic tracker. The clinic developed a live updated map that allows us to see which rooms are occupied and which rooms are free for patients, just to make better use of the space we have available and be as efficient as possible. The map also makes it easier for the new volunteer students and attendings to find the patients in the building. So something we're really proud of, gender affirming therapy. We started to offer gender affirming therapy in early 2018. It is one of the programs that we're most excited to share with you today. So far, we initiated therapy for 17 patients. And for the past year, we averaged about 1 to 2 patients in a month. On the graph to the right, looking at the type of therapy initiated, 9 have been for feminization and 8 have been for masculinization. Our clinic covers the cost of all lab testing, and our pharmacy students ensure that the most affordable therapy for our patients is picked. What we offer at our clinic is actually pretty unique, as we're seeing patients from all over North Florida, traveling long distances from Jacksonville to Tallahassee to receive care at our clinic. So given the dynamic nature of the volunteer-based clinic, we often have different students and attendings on different nights. So it was really important, we thought it was really important to create standardized protocols in order to provide the best and consistent care for the patients. So essentially the protocol divides the patients into 3 categories: initial consultation, initiation of therapy, and follow-up. We start the initial consultation with a history and discussing expectations and potential side effects, as well as ordering baseline labs. We initially started this program with the requirement for a letter from a therapist. We quickly transitioned to an informed consent model, which we believe allows us to treat gender affirming therapy like any other treatment that would be provided at a physician's office, and remove some of the unjust stigma associated with our patient population. The second visit, if appropriate, would be for initiation of therapy, where we would go over the informed consent, review the baseline labs, and finally prescribe the hormone therapy. The following visits after that would be for follow-up every 3 months, and we would continue to track the appropriate labs, how the patient is doing and feeling with the therapy. So the next 2 slides are snippets of informed consent that we used. We provide the patient with these informed consents on their first visit, discuss with the patient, allow them to take it home, review it, and then finally go over it one last time when they come back to initiate therapy. The first one you're seeing is for masculinizing hormone therapy that goes over use of testosterone and the expectations and risk associated with it. And the next one is a slide for feminizing therapy, discuss estrogen, androgen blocker use, and their respective potential benefits and side effects. So the next 2 slides, I know I'm going over a lot of the protocols. The next 2 slides are comprehensive protocols that we use that was developed with information from the Fenway Clinic. We have one both for feminization, masculinization, and they go over the specifics of initial evaluation, labs to order, therapeutic options, and some of the associated risks. So a new volunteer coming in would have all the information they would need. Next slide are these small, the one after this. These are small handouts we made for students to simplify the Fenway protocol, specifically for follow-up. The Fenway protocol does have a lot of information, but these little handouts are very, very useful to have a quick glance and know what the next steps need to be. It goes over which labs to order, what to look for in a simple, easy to read manner. So something else we're really excited about recently, to make it easier for our health professional volunteers, we started using a clinic navigator. This is something, it's a program that allows us to volunteers to select the appropriate clinical protocol and takes them through step-by-step question, gives instructions on what to do. For example, which labs to order, which data to record, what medications to prescribe. On this slide, you can see a list of protocols we have, and each would take the volunteer on a different series of steps. As you can see, we have one for prep and one for enrolling patients in gender affirming therapy. So on the next one, on this slide, we have steps a volunteer would see for initiation or follow-up therapy for GAT. It reminds volunteers which labs to order, asks about informed consent, documentation, asks to document patients' most recent labs, the therapy prescribed, and finally, patient satisfaction. This is really a great tool for volunteers who might not really be familiar with gender-affirming therapy, and makes it so that every student can feel comfortable that they're doing everything they need to be doing to provide appropriate care for our patients. So the Clinic Navigator has been really exciting for us because we can use the information we collect and tabulate the data to not only see the summary of our patients in gender-affirming therapy and know and how they're doing with regards to their labs and satisfaction, but also visualize how our program is doing overall. So we're very happy with it.
All right, just like for gender affirming therapy, we created a standardized protocol based on the CDC guidelines for PrEP initiation and maintenance. So first of all, PrEP stands for pre-exposure prophylaxis and is prescribed for the prevention of HIV. So as you can see here, we created very similar protocols. This is also given out to volunteers, and physical copies are on site every LGBTQ plus night. So for initiating PrEP, the basic steps are to assess the risk factors, which include men who have sex with men, heterosexually active persons, and persons who inject drugs. Then we'll go on to clinical eligibility, which includes HIV testing, renal function, and hepatitis serology. Then we'll go on to prescription, which Truvada, or now also Descovy, can be prescribed. And then we'll have some safe sex education, no matter the patient. So as I said, those are our basic steps in initiating PrEP therapy. And then the next page will show you our handouts for monitoring and follow-up. Okay, so our first month on PrEP, we're going to evaluate the adherence to medication. We're going to schedule a follow-up appointment, and we're going to assess risky behaviors. And then at every appointment, we will provide risk reduction counseling. So once PrEP is initiated, patients will be scheduled for follow-up appointments every 3 months. And these follow-up appointments are scheduled by our undergraduate volunteers. They schedule the appointments, call the patients to remind them of their appointments, and then also call to remind about getting labs and such before the appointments. So at least every 6 months, we will check a serum creatinine, conduct another STI test for sexually active adults, even if they are asymptomatic at this time. And then at least every 12 months, we'll evaluate the need to continue PrEP and continue with risk reduction and safe sex counseling. Okay. And again, we use REDCap to follow patients and monitor their progress. We use the system, the Clinic Navigator that Jabbar walked you through earlier, to make sure that all of our patients are on track, that we're following their labs correctly, and that they're scheduled for appointments. Okay. So Equal Access Clinic is able to help patients receive PrEP at low to no cost. Our pharmacy students have been amazing at helping our patients get PrEP at no cost. They've figured out the Advancing Access Patient Assistance Program by Truvada, and they've been really great at helping patients fill out paperwork, making sure they stay up to date, making sure they have continued access to care. And now there's also another program called Ready, Set, PrEP, where the government is actually providing some financial assistance as well.
All right. So as far as this slide's kind of about the cost of our treatments to the patients. And so the first chart outlines the typical cost of hormone replacement or hormone therapy for our patients. And as mentioned, we have a pharmacy team on staff each night to help the patients find the cheapest option or pharmacies for their medications, and they can help them fill out forms for patient assistance programs. So typically estradiol costs our patients about $7.50 for a 3-month supply at Publix, which is a local grocery store, or they can actually get it for free through Grace Marketplace, which is a local nonprofit organization that offers a wide variety of resources, primarily for people experiencing homelessness. The cost of testosterone may be dose dependent, but we are typically able to get a month's supply for our patients for about $7.50 at Walgreens or Publix. And so then the second chart at the bottom here just shows that we're able to get PrEP for free through the Gilead Fee Assistance Program, which is basically the creator of Truvada and Descovy, or through other resources like Kelsey mentioned, Ready Set PrEP. So as I mentioned earlier, we initially tracked our impact with paper forms that basically asked patients if they were coming in for LGBTQ plus night specifically and how they heard about us. And so we started doing this around the time that we started offering gender affirming therapy. And as you can see in the graph on the left, we saw a pretty dramatic rise in the number of patients who were actually seeking our LGBTQ plus specific services after we introduced gender affirming therapy. I can attest to this personally, as I was the LGBTQ plus night officer at the time, and we definitely noticed this trend. As far as how people heard about us, we learned that our social media blasts were pretty successful, as illustrated in the chart to the right of the screen. About 35% of our patients reported hearing about us online, followed by about 20% from community events and 15% from a referral by a friend. The social media aspect has actually been really nice because we've been able to get some feedback from our patients on Facebook directly, which I will show you right now. So here's a comment that one of our patients left on our page and gave us permission to share. And so he wrote, "A few months ago, I posted desperately looking for a place that would help get my hormone replacement therapy. I'd been on hormones for 2 years prior, but in a different state with an informed consent clinic. I felt defeated because Florida laws require a therapist to clear a person undergoing gender transformation. Someone in this group informed me of the Equal Access Clinic in Gainesville, and here I am today, back on my prescribed amount of hormones. I went on a Tuesday night where you get to see a doctor for free. I was able to get my blood work done in Ocala for free. After 2 free doctor visits, I got my hormones at a local Walgreens for $24.99. I highly encourage any transgender or non-binary person looking for a way to start hormone replacement therapy to call and visit Equal Access Clinic in Gainesville. My only complaint was that there was a bit of a wait to see a doctor that day, but remember, these people are helping with little income these people are helping those with little income and no insurance. They also have a list of resources of LGBT-friendly doctors, endocrinologists, therapists in the area. An enormous thank you to the person who told me about this clinic. You literally saved my life." And so one other story that I wanted to share was written to us by one of the psychology students that's been helping with in-house psychology services we offer. And so he wrote, "The most recent encounter was with a trans young man who came in for routine care but noted panic attacks and depressed mood. He previously experienced homelessness, was currently living in an unsupportive familial environment, and that bubbled up into a panic attack a day. Seeing patients in this particular situation at the crux of many intersectional disparities is challenging in a few different ways. It allows us to hyper-focus therapy toward developing coping strategies and tools for patients to manage their distress so that they continue meeting their functional goals. In this situation, we provided strategies for managing panic attacks and depressive episodes and workshopped goals for the future. These experiences also highlight the fact that many LGBTQ community members who might need mental health support exist in a space that have limited or no access to it and have minimal continuity of care. I think the impact of LGBTQ Night is huge from a medical and psychological perspective. For this patient and others, it's a new feeling to be able to talk fully about the stressors that affect their health and go to a place where they can begin to feel comfortable in their care. By partnering together and treating LGBT community members holistically, I can definitely tell that we've started to chip away at what used to be a model of care and replace it with an inclusive model that treats the whole individual." So that was what one of our psychology students wrote to us. And it's been really special for us to hear about these experiences and reassuring to know that what we're doing is making a real impact in our patients' lives.
Thanks, Vincent. So some other services that EIC is able to offer are HIV and STI screenings. So EIC is a Department of Health HIV test site. We provide other cancer screenings, including mammograms, pap smears, and we provide specialty referrals through a program called WeCare, where we're usually able to refer patients to specialists at no cost to the patient. And then we also provide preventive care for all patients. Okay, so what's next? We're looking to get HIV test and treat, which is a coordinated effort with the health department to begin treating patients immediately after a positive test result, usually within 48 to 72 hours. The goal being to reduce the viral load in patients that have been infected as quickly as possible. We're also exploring adding LGBTQ plus nights to other EAC locations. When we started LGBTQ plus night, we had it once a month on Tuesday nights, and it's become almost every Tuesday now at our Eastside clinic that we have LGBTQ plus patients and that we're able to provide LGBTQ plus directed healthcare. So expanding to other clinics is a really exciting possibility. And then lastly, expanding training with standardized video modules for our fellow medical students and physicians. Okay, so what setting up a student-run LGBTQ plus directed healthcare clinic looks like? We just kind of thought of some very basic steps, which were initially to recruit a faculty with a background in LGBTQ plus healthcare, to establish volunteer training, to ensure LGBTQ plus competent care, to establish protocols to standardize the care, to make those protocols readily accessible to volunteers, physicians, etc. And then lastly, just to spread the word to the community, which we found social media very, very helpful for. And thank you so much. Are there any questions?
Great job. Thanks so much. Some questions coming in. Have you encountered any issues by being so visible? I think in terms of being so visible and open in terms of LGBTQ plus healthcare, in terms of maybe on social media, any kind of negative issues, comments, concerns?
No negative issues I can think of. I can tell you, like Vincent mentioned, we got a lot of positive, lots and lots of positive feedback, lots of love, and it's been great to see the community embrace this resource.
And a lot of the posting that we do, we are in a lot of like closed groups on Facebook. A lot of organizations have like closed membership groups that like we have joined, and we'll post in there. So they're pretty safe spaces that we're posting in. And sometimes we'll just kind of like share it broadly. But even on the posts that we have shared broadly, because I managed it for quite a while, I've never seen any negative even comments on our posts, which is really nice. I know my roommate works for like Well Florida doing HIV outreach, and sometimes they'll get a lot of hate on their posts, but we haven't had an issue with it yet, thankfully.
Just wondering, y'all talked about, well, first of all, congratulations. It sounds like y'all are doing really great work. My name is Michael Tudine, by the way. I'm one of the providers at Main Street Family Medicine. But I was just wondering, you talked on some of the financial issues regarding how you're able to assist with the cost of medications, but how about labs? How does that end up getting done? It sounds like some people are able to get them done free, but I just know that there's a number of labs to get done, and that could be costly if it's not covered or if you're not able to get it free.
So our clinic covers the entire cost of all the labs. We were actually able to coordinate with Quest Diagnostics, and they were able to lower the lab costs for us enough so that we were able to accommodate that as Equal Access Clinic.
An Equal Access Clinic is certainly, as an organization of students that have a number of grants that they've sought to fund, and I think some other donations that help fund some of this as well. So certainly it's not an endless source, but we've been lucky enough to be able to, at least at this point, offer labs, assistance with labs costs right now. Another question that's come up, or how can medical providers ensure an environment of respect, privacy for queer individuals outside of LGBT plus specialty nights, such as when a transmasculine or non-binary person may need to see a gynecologist, for example? I don't know if you all have any thoughts on that.
I can try to answer that. So that's something that we really are trying to use our standardized protocols to help with. So although LGBT night is only technically once a month at EAC, we make sure to train every volunteer that will come to Eastside Clinic in cultural competency and LGBTQ plus health disparities, healthcare disparities, in language to use when talking to patients. We also have handouts, and every night there will be a LGBTQ plus director present at the clinic. So if anyone has any questions, they can go to those directors, and there will always be culturally competent students and providers at Eastside on any night.
Yes, I agree with Kelsey, but on top of that, just in a general sense, I think just using gender neutral language just at any clinic will make a huge difference in respecting our queer patients and making sure that they feel comfortable at our clinics, regardless of where they are.
Yeah, I mean, I think we certainly try our best, and I think try to aim for training. Like any person or healthcare system, I don't think we're perfect, and though we're getting better. And I think the students have been an incredible catalyst for a lot of that, and so it's been very inspiring. And so we've definitely increased the amount and requirement for training, so that you have an opportunity to learn quite a bit prior to coming to the clinic. Dr. Ryan asked, are you guys seeing any adolescent patients for gender affirming care?
Kelsey?
I was going to say, no, we're not. I believe at EAC we can only treat adult patients, and I think that's been the only reason. Correct me if I'm wrong, Dr. Null.
Yeah, I think it's primarily because myself and Dr. Jennifer Janelle tend to be the primary faculty folks, and we're both by training internists, so a little bit less out of our comfort zone. But Dr. Ryan, would love to have you join us at a future night and maybe expand our options. We certainly are trying to connect with the Youth Gender Clinic here at UF, which is phenomenal, with Dr. Dayton, Dr. Silverstein. So certainly, and a few cases have been able to make that connection and linkage to care, which I think is important. But at least in terms of our scope of practice, haven't felt comfortable taking that on. But I think one of the hopes of these talks is that we can make connections and kind of grow our base and what we can do. So we'll have to talk some more in the future about that.
Possibly if you guys expand to a non-Tuesday night, I could make it. And I don't go, I can't do Tuesdays, but I don't feel comfortable with adults. So.
There we go. Make a good team.
Yep.
Another piece I was going to mention that our officers currently are working on, I know Dr. Geyer, I think maybe on this call, but kind of in a similar token to the resources she's put together throughout our community. The current officers are looking to put together kind of the Alachua County North Central Florida resource guide for LGBTQ plus patients. So really trying to, in one location, put together resources, whether it be for surgical intervention, gender-affirming surgical interventions, hair removal, voice therapy, cosmetic questions, or just LGBTQ plus, supportive, affirming locations and providers. So that's something you may look for in the future, and we'll try to publicize once available. A couple other questions that came up were in regard to some of the flowcharts and resources that the students have developed. We will make those available at primarycareinnovations.cme.ufl.edu. You're also welcome to email any of the speakers today, and we're certainly happy to share. And you're welcome to give us any feedback on those. We certainly welcome it. One last final question I've had for the students is thinking about your own future practice and how kind of engaging and developing this clinic has impacted your education and thoughts about career, and how you might incorporate LGBTQ plus healthcare in your future endeavors.
I'll start if that's okay. So always wanted to be a pediatrician, and I think I took away some major points from this experience here. The main thing being, it's really, really simple to be accommodating and respectful for all patients. You can definitely see a huge difference when you just slightly adjust the language you use and maybe introduce your pronouns just to get these patients to trust you, get them on your side, and open up to you. And then that makes a huge, huge difference on being able to take care of their healthcare needs.
Yeah, I mean, so I'm going into anesthesiology, so it's a little less like clinic based. I won't kind of, have the opportunity necessarily to like tailor my clinic to be, necessarily more welcoming, since I'll probably be in the OR a lot of the time. But kind of to echo what Jabbar said, it's really been helpful in kind of helping me to, make sure that I'm always using neutral language and being respectful and not making any assumptions about my patients. And so kind of like in a lot of those interactions as an anesthesiologist that I'll have like pre-op and post-op, making sure to always be mindful of that. And then also I just personally like to always wear like something on my badge that, lets patients know that I'm like a, LGBTQ plus friendly provider. I have like a rainbow, I don't have it on me right now, but like a rainbow sticker on my badge. And I think, and then like also like a lapel pin that's like a little rainbow thing. And I think that just even for queer patients to see a provider wearing something as simple as that just kind of can give some of them some peace of mind or comfort in, being under your care.
Yeah, I completely agree with what Vincent and Jabbar said. I think it's really shown me that things that providers can do that are very simple and don't take a lot from us, like being conscious about using pronouns, being conscious about introducing yourself with your pronouns, and just making patients feel like they're included in your practice makes such a huge difference. The feedback we've gotten from patients, the amount of patients who come to clinic every night has just been really, really cool to watch grow. And yeah, it's just kind of made me think about how I want my clinic to be set up and how I want to make sure I'm intentional about making everyone feel included and making sure I just have a culturally competent practice overall.
Wonderful. Well, Kelsey, Jabbar, Vincent, thank you so much for this really lovely presentation and for all your work on this clinic. It's truly wonderful. Thanks to all of you for joining today. If you'd like to receive continuing education credit, please give some feedback to our presenters and complete the evaluation. Our next webinar will be November 6th, Thinking Inside the Pillbox, Integration of Pharmacists into Geriatric Primary Care Team Decreases Hospitalizations. Please stay safe, and we'll see you next month. Thanks so much.
Thank you all.
Thank you, Dr. Nall.
Great job, Jabbar. That was wonderful.